Throughout this pandemic, we've had new words come into our normal everyday language. Cytokines, Doffing, ARDS, ECMO. What do they all mean? Well, we're going to explain 26 of them in this video. All of these were suggestions by you, so thank you for that. And thank you also to everyone that has donated, as this video is a fundraising effort. I know it's a difficult time for everyone, and I know many charities are struggling for donations and are unable to run events. One of these charities, Sparks, raises money for children's medical research. So if you can spare some money, then jump on the link down below to find out why I chose this charity and how to donate. If you can't afford anything, that's fine. I'm giving all the advertising revenue from this video to the cause. So just watching this and sharing the video around will also be a huge benefit. You may think, why 26 medical terms? Well, it's supposed to be the London Marathon this weekend, so I'm doing one medical explanation for every mile. To be honest, it's much easier to chat than run a mile, so I'm kind of loving this. So thank you very much in advance, and let's just jump into it. Number one, COVID-19. Oh, I'm gonna need that. Number one, COVID-19. What does it stand for? Well, it stands for corona, that's the CO, virus, that's the VI, disease, and 19, the year that it started. SARS-CoV-2, so this is the name of the actual virus that causes the disease COVID-19. So SARS stands for severe acute respiratory syndrome. CO stands for coronavirus 2. SARS was the first to cause this severe acute respiratory syndrome, so this is the second virus that has a similar picture. So acute means something that happens very quickly in medicine. It doesn't have a defined time period, but something that usually gets worse rapidly. So the R stands for respiratory, so that's made up of your upper airway, so your nose, your mouth and your throat, and your lungs, so it makes up the lower airways and all the way down to your air sacs, so the alveolar at the end of your lungs. And it's really if the infection gets into these alveolar air sacs that it can cause the severe complications. And the S stands for syndrome, which means a collection of symptoms. So in this case, a severe acute respiratory collection of symptoms that makes up the disease. And the CoV again stands for coronavirus 2. And it's worth noting that there are many types of coronavirus. You no doubt have been infected by one within your lifetime, as it's one of the viruses that cause the common cold. Anosmia is a posh word for losing your sense of smell. There's also ageusia, which is losing your taste, both of which are possible symptoms of COVID. I'm not sure we know exactly the reason why, but I'm guessing it's likely due to the virus directly infecting and destroying those cells with those special receptors for smell and taste. Next up, pneumonia. So we mentioned the three main areas of your respiratory system, the upper, the lower, and the air sacs at the end. And pneumonia is an infection in the air sacs, so the end part of the lung. This is the worst place you can get it because you need the air sacs for gas exchange for the oxygen and carbon dioxide to be transferred to and from the bloodstream. The interstitium, so around the air sacs, right at the end of the lung, we have this beautiful elastic tissue that helps the lung expand and collapse. This is the interstitium. You may have heard of interstitial pneumonia, so that means when the connective tissue is involved in the infection. Pneumonitis. Whenever we hear the phrase itis, it means inflammation. So appendicitis would be inflammation of your appendix, tonsillitis, inflammation of your tonsils, and pneumonitis is inflammation of the lung tissue. In the case of COVID-19, the inflammation is partly due to infection, but partly due to your immune system damaging your own tissues. Cytokine Storm. Loads of you guys sent this one in. We just talked about the immune system attacking our own body. That's what a cytokine storm is. Cytokines are chemical messages produced mainly by your immune system to coordinate their battle plans. So cyto means cell, kine means movement because they mobilize your immune system. Don't forget, your immune cells are deadly weapons. They are designed to destroy germs by digesting them and injecting them with horrible chemicals. So a huge rush of cytokines in a storm is not a very well coordinated response. It's like sending in a whole army to deal with a shoplifter. This creates a huge amount of damage. ARDS, acute respiratory distress syndrome. This is the picture we see many people with serious complications of COVID-19 end up with. It's essentially a state of widespread pneumonia, so infection, with pneumonitis, so inflammation, caused by the cytokine storm. All this means your lungs get filled with inflammation, meaning that the air can get into the air sacs but cannot pass into the bloodstream. I mean, look at these images here of a CT scan showing ARDS. The lungs should be black, indicating air, but they are white because they're filled up with gunk. ARDS actually has a very technical definition which requires a fair bit of medical knowledge to break down, so I'll leave that for another video. Coagulopathy, another great one. So coagulation is the term we use for blood clotting. A useful thing, right? Because we don't want to bleed to death. But when blood clots inside a blood vessel and blocks it, we call that a thrombus, and that's a bad thing. And the term pathy simply means something wrong. So coagulopathy is something wrong with your clotting. And you may have heard this in the context of Covid-19. We're seeing many patients having blood clots in their bodies, and we're not quite sure why, but one reason is undoubtedly because of this cytokine storm, because whenever we have inflammatory cells activated in our body, our blood is more likely to clot. Innate immunity. Whenever we first see a virus we've never seen before, like the coronavirus, our body responds with innate immunity, a very crude way of destroying it. And it tends not to be very effective, but it kicks in very quickly. And that leads nicely on to adaptive immunity. During an infection, our body learns what that virus is made of, such as certain proteins, and these become targets if the virus ever attacks again. These targets are called antigens. And at the heart of this adaptive immunity is antibodies. Your proteins that stick to these antigens is sort of like a hashtag or a bounty on the head of the virus that tells your immune systems to destroy that virus. This is your adaptive immune response, and it is highly effective compared to your innate immunity, but it takes time for your body to learn and create these antibodies. Antibodies such as IgG and IgM. So right on cue, Ig stands for immunoglobulin, which is the posh name for antibodies. And the G and M are just two of the 5 types of your antibodies. Your body produces the IgM antibodies first, and they mainly stay on your bloodstream, and they'll be produced again if you ever have an infection from the same bug, but generally they'll then disappear if you don't need them. IgG antibodies, they last a bit longer, but actually are produced a little bit later in the acute infection. Plasma exchange, another excellent medical term. So you may have heard this one as a potential treatment for COVID-19. So if you take all the cells out of your blood, you are left with the blood plasma. Within that plasma will be antibodies, what we talked about before. So it is thought that by giving people currently ill from the disease the plasma from someone who has successfully recovered from the disease, this will transfer the antibodies and help the person fight the infection. And we know a similar technique works in the treatment of rabies. Hydroxychloroquine. So this is touted as a potential treatment for COVID-19, as in experiments in the lab, other types of coronavirus were inhibited by it. This is a drug used to treat some inflammatory conditions like lupus and rheumatoid arthritis, but also used as a treatment for malaria. Trials are still ongoing. There's currently no clear evidence of its effectiveness yet. The R0. This is the basic reproductive number, so it's a measure of how quickly a disease which no one is immune to spreads through a population. So the R0 of the flu virus is usually around 1.5. This means that on average, every person infected will spread it to 1.5 people. We're still working what the R0 for COVID-19 is, and estimates vary between 2 and 5.5, quite a widespread variation. A small rise in the R0 has a huge impact on the spread. For example, let's take an R0 of the flu of around 1.5. After 10 lots of transmissions, would be around 58 people infected. However, with an R0 of 3, after the same kind of 10 transmissions, would equate to 59,000 people infected. Therefore, the most important thing you can do in this disease is to social distance and follow the government advice to reduce the R0. The viral load. How much virus is currently in your body? So you've probably heard this term used in relation to the spread of infection, as if someone has a large amount of viral load, they are likely to shed more of this virus into their respiratory tract and therefore more likely to pass that on to someone else. Infectious dose. So this is how much of a virus you need to be exposed to in order to get the illness. So if you get one virus particle on your tongue, it's probably not going to cause an infection. So how many particles you need in order to cause the infection? Well, that's the infectious dose. What is of particular importance is, does the amount of infectious dose you're exposed to also mean you're more likely to get complications? We don't know the answer to that, but it certainly holds true for other coronaviruses. Negative pressure rooms. One interesting thing to write in with. So in medicine, we change the pressure in patients' rooms depending on whether we want to prevent air coming in or out. So in operating theatres, there'll be a positive pressure in the room because we don't want airborne bugs to drift into the sterile area when we come in and out of the room. In Covid-19, it's best to use negative pressure rooms to stop any of the virus from infected patients spreading into the corridors. AGPs. I've spelled it wrong, that should be AGPs. Aerosol generating procedures. These are medical procedures that we do on patients that are likely to throw tiny droplets into the air called aerosols, so more likely to infect the healthcare professionals doing the procedures. These include things such as intubation, so putting a tube down someone's throat to ventilate them. PPE, so another phrase that I wish I had shares in. You've probably heard a lot about this. It stands for personal protective equipment, which is kind of a posh phrase to say stuff you wear to reduce the chance of infection. So things like goggles, masks, gowns, and gloves. And the level of PPE you need varies depending on the task you're doing. For example, when doing an aerosol generating procedure, you want maximum protection as that has a high risk of exposure. Doffing. So this is a term used for taking off your PPE carefully. It's all well and good wearing PPE, but actually taking it off is also risky. So you've spent all your time with that patient, no doubt having all your gear covered in the virus. So taking the gear off must be done very carefully, slow and systematic, so not to throw any particles up into the air so you don't breathe them in. Fomite. Another great word. So fomite is anything on the surface that can transmit an infection. So the COVID virus is in the moisture of our breath. So if we touch our hands and then touch another surface, that could transmit it onto the surface and then onto someone else. So common fomites are things like door handles, your phone, your actual hands themselves, clothes, or things like chip and pin machines. Okay, so the remaining terms are actually all kind of related to ventilators, and I'm not an expert on that, but I know someone that is. Sonia?
Well, ventilators are my bread and butter, so I think I can help with those. PaO2 over FiO2 ratio. That's a pretty technical term. It's also known as the Horowitz ratio, or more commonly the PF ratio. And what it is basically a ratio of how much oxygen gets into the blood compared to how much you're putting into the air sacs. So if you give people lots of extra oxygen to breathe, then you're increasing the concentration in the air sacs, and in theory, the blood concentration should go up. But in a disease like COVID, there's a problem with the air going from the air sacs into the circulation. There's lots of inflammation there that stops that process. And when that happens, the PF ratio goes down. And that's actually what we use to define ARDS. It's a technical term. And if you hit a certain value on the PF ratio, then you've got ARDS and you've got very bad lungs. Next, we have number 24, CPAP. Continuous positive airway pressure. That's a mode that we use on ventilators, or a setting, and it provides a constant push of air into the air sacs. Air sacs are just like balloons. If you take a party balloon and you try and blow it up from empty, it's really hard. But if you just get it going and hold it in that midpoint, it's really easy to make it expand fully. So the point of CPAP is you blow air in when people breathe in and breathe out so that the lungs don't completely collapse and the air sacs don't collapse. And that means with the next breath, because they haven't gone down to completely empty like an empty balloon, it's easier for the next breath to happen. And that leads us on to BIPAP. So BIPAP's another mode that we use in ventilators, bi-level positive airway pressure. And the difference with that is, as well as that lower level that stops the air sacs from collapsing, when you breathe in, you also give a bigger push or a second level of support, and that allows those air sacs to expand even more than they would otherwise. So we use BiPAP when people are needing not just extra oxygen, but pressure to help push the air into the lungs because their lungs are very poorly, or because the patient's very weak. And finally, number 26 here, we have ECMO. So ECMO is extracorporeal membrane oxygenation. So extra means outside, corporeal means the body, membrane uses a membrane to cross over, oxygenation. You use a very big drip that you put into one of the blood vessels and you suck blood out of the human body into a machine, which is a bit like a soda stream, and it bubbles oxygen into the blood, and then you can return that blood to the body, which is now nice and oxygenated, which means that you can bypass the lungs. So in some COVID patients who are really, really poorly, a ventilator doesn't work. The lungs are so damaged. It's a very, very specialist service that's only available in a handful of hospitals in each country. So it's not something that can be used on all patients with COVID, nor would you want it to be. It carries many, many risks. You have to thin the blood in order to take it out of the body and pass it through the machine, and that can cause catastrophic bleeding, particularly on the brain, and that can cause death. So it's a mode that we use as a very much a last resort in very few patients that we believe might have the capacity for their lungs to get better from this. And I think that's a wrap.
Oh my word, that is a wrap. Thank you so much.
Was that all right?
Oh, you nailed it. So there you go, all 26 phrases jargon busted. If you have any other phrases that you want to know about, then leave me a comment down below, and myself or the super helpful community will give you some details. And talking about the fantastic community, we have raised over £1,000 already for Sparks, funding medical research into childhood illnesses. Thank you, thank you, thank you, you amazing people. But why stop there? Let's see how much we can get. I reckon we could get as close to 1 million as possible, and just share the video around and let's do it. All right, I'll leave this video again. Thank you for all your support on the channel and this vlog, and I hope you're all well, and I'll see you all soon.